GLP does not differentiate between fat and muscle. You lose them equally if you don't take right measures. If you're not taking enough protein or if you're not doing the resistance training, you're gonna lose a lot of muscle mass, which can lead to, so many other problems. Besides that, if you're not focusing on right nutrition, you can also have some nutritional deficiency, and that can lead to, hair fall. Patient also feel very fatigued. These are some of the overlooked side effects.
Welcome back to Intentional Medicine with Dr. Singh. And today we're tackling one of the most talked about and most misunderstood topics in health right now, GLP-1 medications. Everyone seems to have an opinion on Ozempic and all the drugs like it, but very few conversations actually separate the hype from the actual medicine. So I'm super excited to hop into this episode. I hear about Ozempic and all the GLP-1s all the time like everyone else. So Dr. Singh, I'm glad that you're here. Let's clear up these misconceptions. And before we hop into anything, how are you doing today? Are you excited to be here and talk about this?
I am super excited to be here, Leila. Thank you so much for having me here.
Absolutely. So GLP-1s, like I said, are everywhere right now. They're talked about at dinner parties, they're in the news, they're on social media, and everyone seems to be talking about that, whether they're with friends or online, or it's just everywhere. So it's hard to figure out where to really start separating the fact from the noise. So where do you think we should start even separating the fact from the noise?
Oh, Leila, I'm so glad that we are starting with this question. I tell everyone that GLP-1 agonists, they are the medication of this decade. But I want to start by stepping away from the social media and the noise that we have created around the GLP-1 and remembering that these are the real prescription medication. They are not beauty treatment. They are not quick fixes. They are true medication. And these medications can be extremely effective for the right patient because there is a science behind them. They reduce appetite, they improve satiety, they help with your blood sugar regulation, and they also impact your cardiovascular and metabolic health. But the noise, I think, begins when we hear a statement like, everyone should be taking one of the GLP agonists, or on the other extreme, some people are saying that, the using medication is cheating. So I want to say that neither is true. I think the right question isn't whether this medication is good or bad. The right question is it appropriate and safe for a given patient?
Absolutely. And I've heard both sides of it just from the media, obviously, and then working and having the pleasure of interviewing so many doctors. I think that what you said is exactly right. I couldn't agree more that it really is a medication that's helpful for the right patient. I think a lot of the noise comes from people who may not truly need it, who are taking it and maybe either misusing it or not using it in the right way, that is creating some of that noise and that confusion. But what do you think is the original clinical purpose of these medications? And if you think that's shifted, how do you think that has shifted?
Yes. So GLP receptor agonists, they were originally developed for diabetes management because these medication help to release insulin when body is exposed to glucose or when the glucose is elevated. They also help to reduce our glucagon. They slows down gastric emptying, and they also communicate with brain, telling them that, you have had enough to eat. So kind of, working on our satiety center. But what happened when physicians, they use this medication for diabetes? They also noticed, significant change in patient weight. And then, more research done in this particular space, more data collected, and eventually FDA approved this medication for resistant obesity or, chronic metabolic syndrome where patients were struggling with weight management. So the purpose has expanded. Initially, it started for controlling the blood sugar to now treating the resistant weight or obesity and chronic metabolic syndrome. But one thing that I am seeing now, which is slightly alarming, that now it is shifting towards cosmetic use. Now, people are treating it or using it as a quick fix or as a, magic treatment for the cosmetic purposes.
Hmm. Absolutely. So, what does responsible medically supervised GLP-1 use really actually look like?
I think that's a very important question, Lela. And I start that at Aterna Wellness MD, it begins with full evaluation, which incorporate having a detailed medical history. So we start with, what's the patient dietary habits, how's his nutrition looks like, what's the exercise, whether it's a part of their daily routine or not, and also what's their stress pattern. We also look into what this patient has done in past in terms of weight loss. And once we gather all these clinical information, we focus on biometric analysis. And biometric analysis doesn't mean that we check only weight or BMI, because we also look into percentage fat. We do the visceral fat analysis. We also look into muscle mass, the abdominal girth, because these are some of the metrics that can be really valuable later on in managing or assessing the progress on GLP-1 therapy. So once we have that, we take also do a detailed review regarding whether patient has any contraindication or not. We know some of known contraindications, such as if you have any personal or family history of thyroid cancer or MEN2 syndrome. So after doing that, we also want to learn what patient personal goal, because it is very important, align with what patient personal goals are in terms of weight loss. And, sometimes it requires realignment in a way that they come with very unrealistic goal or the time frame that they want to reduce this much weight in this time period. So we also go in very detail what this medication can do and how effective and safely we can achieve the goals that person has in their mind. um, After that, we also run some, the very common labs pertinent to the obesity, such as CBC, CMP, HbA1c, lipid panel. These are some of the thyroid, which is very important in women. Sometimes subclinical hypothyroidism can also lead to weight gain. So ruling out other possibilities causing, weight gain. And once we have all these, then we start patient on a protocol. And even when we start patient on GLP-1 agonist, we also create a parallel plan regarding their nutrition, their exercise program, registrant training, sleep, bowel regulation, and follow-up. And we also create a regular monitoring, the how we're going to do that, because we don't primarily focus on pound loss. We focus on the waist circumference. We look at the metabolic markers. We look at strength and overall body composition. So let me share one example. So one patient came to us, and she came with that, I want to lose this amount of weight in this much time frame. So our team sat down with her, and as I listed earlier, we took a detailed history. We did her biometric analysis. We ran certain lab tests. We ruled out all contraindication, and when we found that she was the right candidate for GLP therapy, then we created the whole plan. So, initially she was skeptical. She thought that we are not, rigorous enough. But when we started the protocol, she loved it. The reason is, yes, she didn't lose the pound that she wanted to lose in a given time frame, but the journey was so easy for her. She was also scared when she was starting the treatment, because she heard about all the side effects. Some of her friends took the GLP and they encountered all those side effects. But we truly monitored her progress, and we looked into how she was tolerating those medication. And while doing that, we also focus on her nutrition, her protein intake, her the exercise program. So at the end, she not only lost weight, but she felt more energetic. She felt like the vitality that she was looking, and she really felt like, she said, this is the best I ever felt in my life. So I think that's very important, that the whole GLP journey should be medically supervised and personalized.
Absolutely. And I think that, like you said, having that supervised program and individualized for each person is how people really are using the medication in the right way and really benefiting it from it. I think that a lot of the noise and the confusion comes from people, kind of like we touched on earlier, maybe misusing it or not using it with a provider who's actually coming up with a plan for them. For example, I had friends who have taken GLPs, and I've had friends who have done it through doctors. I've had friends who have got it from Groupon, if I'm being honest. Like, we all know these stories of people taking it the right way or perhaps not taking it the right way. So I think that that's a big part of really taking it the right way and reaping the correct benefits from it when you do it with a provider and you have a plan, and you might not lose it exactly like you said with your patient who may have took her a little bit longer to lose it, but I'm sure her results are better. She'll probably keep the weight off. Some people lose weight really quickly and suffer the side effects, and then they kind of gain it back. I personally know I have a friend that happened to as well. She lost the weight. She was super sick, had a lot of the side effects, and then gained some of it back. And then I know people who did it the right way, as if you're like what you're describing, and they feel good. They kept the weight off. It became more of a lifestyle change. But speaking about that, what do you think some of the risks or some of the downsides that people really aren't hearing enough about when it comes to these medicines?
Yes, Lela, there are some known side effects that most of the people know. That is primarily GI side effect that some people encounter nausea, some have vomiting also, or constipation, diarrhea, gastric reflux. Some of them can have, mild abdominal pain. But these are primarily dose dependent and, how you titrate these medication. So if you titrate them slowly, someone can, control these side effects. Some of the serious side effects, such as patient can have pancreatitis, they can have gallbladder diseases, or if they have intractable vomiting, they can have dehydration induced kidney injury and those things. The other thing that, as you know, the GLP, they have a black box warning of the thyroid cell tumor that primarily, it was seen in animal studies. So they are contraindicated in any patient who has a personal or family history of thyroid cancer or Mann-2 syndrome. But I think the area that has, overlooked the issue that is becoming a big problem is muscle loss. So I always tell, all my patients that GLP does not differentiate between fat and muscle, and you lose them equally if you don't take right measures. So if you're not taking enough protein, or if you're not doing the resistance training to support your muscle and bone, you're going to lose a lot of muscle mass, which can lead to, so many other problems. Beside that, again, if you're not focusing on right nutrition, you can also have some nutritional deficiency, and that can lead to, hair fall. Patient also feel very fatigued. They feel they don't have energy. So these are some of the overlooked, side effects. Let me share another story. When patient came to me, he took medication from somewhere else, and he lost his weight very drastically or suddenly. So when he came to us, he was like he had no energy. He said he was feeling fatigue all day. In fact, he was not happy with his overall look. He has that, that now we call it Ozempic faces, that not look, that appearance you have on your face. So when he came to us, I said, you know what? Let's not focus on medication dose or, weight loss. Let's focus on the other things. So we definitely, worked on his nutrition, added some real good protein to his diet regime, and we added some exercise program. We also gave him some support of NED and, other peptides. And at the end, he was feeling, very energetic. We also did some, energy-based therapies for his hair fall and all those things. And we did a full, biochemical panel to look deeply, what deficiency he was having. So it is like, people don't realize that, people don't hear about that. They just focus on the weight loss part. But these are some of the downside of these therapies if they are not done, properly in medical guidance.
Absolutely. And I've heard a lot of stories like that as well. And for example, my friend who lost all this weight super quickly, and like you said, the Ozempic face and all these different things as well. So with all of these patient stories that you're mentioning, and I'm sure at this point, everyone has either had an experience with GLP-1 or a friend who has an experience with GLP-1. And it sounds like so many people have taken them. But how do you really decide if a patient is actually a good candidate for this medication?
Yes. So at Eternal Wellness MD, we look at patient whole clinical picture. So as we all know that FDA have approved weight management medication generally for adult with the BMI more than 30 or 27 with other comorbid conditions such as hypertension, diabetes, cardiovascular diseases, or sleep apnea. But you know what? I don't fixate on the BMI alone or weight alone. We also look at, visceral fat, waist circumference, insulin resistant, fatty liver, cardiovascular risk, the mobility, sleep. So how the weight is, in totality affecting that person's health and quality of life. So once we, screen for contraindication, and we also look into whether, particularly for female patient, whether they have any pregnancy plan or not, whether this patient ever had a severe pancreatitis or gallbladder disease, or whether they have any GI issue, severe GERD, which is a gastric reflex diseases. Once we rule out all these, and including, some of the other contraindications, such as I mentioned earlier, like, the thyroid cancer, personal or a family history, we decide whether this patient is the right candidate or not. So, you know what? And the other thing we also incorporate when we decide whether someone is a good candidate or not is patient personal goal. Someone wants to lose 4 or 5 pounds just for a wedding or, a special event coming in their life, versus someone is struggling with some medical disease that can be benefited if patient lose their weight. So we look at the whole picture. I again remember one patient came to us. She was elderly woman, and she was, of course, her BMI was high, but she had also had, severe knee osteoarthritis. So what was happening that because of her weight, she was having more pressure on her knee, and her osteoarthritis was getting worse. But because of the osteoarthritis, she was not able to participate in, exercise, to walk and all those things. So it was kind of creating a loop for her. Her weight was worsening her osteoarthritis, and her osteoarthritis was leading her, or, her not able to do the exercise. So we looked into the whole picture, and we felt that if we can, help her to reduce some pounds, that can not only help with her osteoarthritis, but will help her to move better. And once she move better, she can have, the stiffness and all those things that she was happening because of osteoarthritis, that can get better. So we put her on protocol, and she lost some weight, and she was so happy that after losing those pounds, she was able to walk better. She was able to participate in, physical therapy better. She was able to follow the exercise regime that was given to her. So I think that is very important, that we need to see the whole picture. We need to look the patient in totality rather than just focusing on pound or BMI.
I think that's so important that you pointed that out about the whole picture. And for example, someone who's been struggling with weight loss due to a lot of different health issues and things like that, versus someone who just wants to lose, let's say, 4 or 5 pounds for a wedding or an event or something like that. So let's kind of talk about the quick fix culture framing directly. So what's the danger in really treating this as a shortcut rather than part of a broader plan?
Yeah. So, you know what? This quick fix mindset just focuses on getting the weight off. While the good medical care, it asks how we will protect the patient health while losing that weight, and how we'll also maintain the result that we have achieved through the GLP-1. So, as we all know, the medication suppresses the appetite. But if patient never learn how to eat adequately, or move consistently, or manage their stress, or protect the muscle, then treatment remain fragile. Either they become demotivated, or because they develop so many deficiency and side effect that the compliance goes down. And most important thing, when therapy is stopped, the appetite may return, and they can gain the weight again. So, I remember the one of the patient came to us and she told us that, because of the GLP-1, her, finally the food chatter, the noise she was having, she was able to suppress that. And now that she has suppressed that food noise, she has created some mental space, a clarity where she can focus on nutrition. She can think about, structured meal, having more protein and, incorporating walk and other exercise in her daily routine. So, I always say that the medication, it gives us a window opportunity, but it up to us, how we're going to use that opportunity to create some habits that can help us to sustain the results.
So, how does this fit alongside the foundational work that you've really talked about in earlier episodes? For example, sleep and movement and also metabolic stability.
Yes. So, Lala, GLP therapy should support the foundation. It should not replace them. So, anytime if someone decides for GLP-1 therapy, I also ask them that the foundational piece goes along with that. Because we all know, as we discussed in previous episodes, that poor sleep, it can cause, hunger, craving, insulin resistance, and at the end, emotional eating. On the other hand, if you have a movement, it can improve your insulin resistance. It can help with your cardiovascular health. The resistance training that can help or support your muscle and bone, and adequate nutrition can give you energy and recovery. So, sometimes as I just said earlier, that these medication make these foundational change more achievable because they provide us that window opportunity where the things that were very difficult earlier to incorporate because of various reasons, as I said, that if you had a problem with mobility due to heavy weight, now that you lose weight, you can incorporate exercise into your program. Someone whose hunger previously felt overwhelming may finally have the mental space to make intentional food choices. So at Eterna, I always say that foundation first. Medication, always comes after that. They are one of the tool, but foundation is truly that determine the quality and the sustainability of that given treatment protocol that we are putting in place.
Absolutely. And I think that this is an important question. So, what does an ethical conversation with a patient about these medications sound like in your practice? We've talked a little bit about the right people taking it and things like that. So, when it comes to an ethical conversation between a patient and yourself, what does that sound like?
So it sounds honest and pressure free. So I always tell patient what this medication can accomplish and what it cannot accomplish. We are very realistic about the outcome. We also tell them clearly about the side effect and, the serious warning sign. The cause, the possibility of obesity may require long-term treatment. These are some of the other conversations that we always have with patients. And, one thing I always make very clear that it is an optional. The patient should never feel sold a medication or ashamed for wanting one. So we discuss, alternatives. What are the alternatives patient have if they don't want to go on the GLP-1 therapy? And if we agree to go ahead with the treatment plan, then we also define the success. Because at Eterna, the success is not only about losing weight. We also talk about the glucose control, the waist circumference, the improved mobility, and overall, energy. And by doing that, how we can preserve their muscle mass also. So, the ethical care is means, when it comes to ethical but practice, it doesn't mean prescribing the medication. It is about prescribing the right medication to the right patient and being transparent about the whole process that sometimes also include from where these medications are coming from. And patient also deserve to know what exactly they are taking, the source of those medication. So these are some of the conversation that we always have at Eterna Wellness MD, and we always try to remain transparent about the whole process.
Absolutely. And like we touched on, there's definitely a lot of stigma on both sides. So the people who judge and the people who really see it as a miracle cure. So how do you navigate that as a physician within your practice?
Yes. So, I always try to bring conversation back to biology and do it with a lot of compassion. So, the obesity, there are a lot of social stigma attached with that. We label obese people by saying them either they are lazy or we call them they are not disciplined. And a lot of time they are given these suggestions, oh, you know what, just eat less or go and work out more. But now the science has proved that the obesity is a complex medical condition. And sometimes, patients are fearful to take medication because of the stigma attached with it. They think that it is cheating. But I always tell my patients that, like the hypertension, when we treat hypertension, that is not cheating. When we treat diabetes, it is not a cheating. So why should treating obesity, seen as a cheating? You need the medication because you have a medical condition. And once we put the whole biology in place, then conversation become, very easy. So we also tell them that the GLP therapy is not magic. It does not automatically produce the good nutrition, strong muscle, or emotional well-being, because they have also do their part. They have to follow the regime that we are, providing them along with the medication if they want the sustainable result. So I always tell patients you don't need to feel ashamed of using a medical tool, but we should also be respectful that the tool enough to use it thoughtfully. Because as we discussed earlier, that these medication are also getting a lot of popularity in a terms that they are the magic, fix. So that is very important that we need to differentiate that these are a medical treatment that require close supervision rather than, treating them as a miracle cure.
Absolutely. And when you mentioned that, I also had a similar thought that I've heard before about how it is a medical condition. Obesity is now being more so recognized as a medical condition than previously, in previous times rather. And really having this medication can help improve the quality of life for so many people. And for someone who is considering this path, what questions should they really be asking their provider before starting?
Yes, I would like to encourage everyone whenever you go to any physician and want to be on GLP-1 therapy, the first and foremost question they should ask that why do you believe I'm a good candidate for this therapy? And and after that, ask about the science, whatever therapy, the weight loss therapy you are deciding to go on or to follow. I always say that look at the science, look at the data that is available that can support that given treatment regime. And once you decide, then also be aware about the side effect contraindications. So go over that in detail. And once you are on the medication or you very sure that you're gonna do that, also ask, what is the monitoring gonna look like? Where do you see yourself from now to, coming 6 months? And whatever the results you are going to obtain or achieve in that given time frame, how you gonna sustain that? What is your weaning plan? Are you gonna be on those medication for lifetime, long term? Or, there is any plan to wean off that medication once you achieve your goal? The some other question I always encourage patient to ask that the what happen if I have those side effects? How I am going to manage those side effects? And definitely there are some other questions these days have become very relevant. One of them is cost, and the other thing is from where this particular clinic is procuring that medication. So these are some of the questions the patient should ask. And then I think the last and the most important question that how they gonna maintain the results that they are going to achieve because of this therapy, how they gonna sustain those outcomes because we are seeing particularly those patients who are going for the rapid weight loss. The moment they stop the medication, they gain the weight again. So these are some of the question they should ask. And if the only conversation is here is your medication and come back when you need a refill, I cautious the patient that that's not the level of care they should go for. They should pause and they should rethink about the whole treatment plan.
And then I have a good question as we kind of wrap up this episode. But If you had to really sum up your philosophy on GLP-1 in one line for someone who's on the fence, what would it be?
So I want to tell everyone that GLP therapy is not a shortcut. It is a very powerful medical tool that works best when it is intentionally prescribed, responsibly supervised, and built on foundation of nutrition, movement, sleep, and stress management. Because once you do that, then only you can have a sustainable and long-term metabolic health.
Absolutely. And then I think that this is a perfect example of what intentional medicine is really all about. And it's not rejecting new tools and not chasing them blindly either, but really using them with clarity and a real plan behind them. Dr. Singh, thank you so much for really cutting through the noise on this one. It's a super important topic. Everyone's talking about it. And if you're considering this path for yourself, we hope today really gave you better questions to ask and more clarity. Dr. Singh, it's a pleasure speaking with you as always. We'll see you next time. And for our listeners, make sure that you are following, subscribing, and sharing the show. And we'll talk to you soon.